Today, I'm going to be taking some time to briefly explain what exposure and response prevention treatment is. So for those of you who are watching this video, perhaps you've recently received a diagnosis of obsessive compulsive disorder, specific phobia, a diagnosis related to one of those areas, and either through your internet research or through the professional who offered the diagnosis, you've learned or been told that exposure and response prevention is the gold standard of treatment that you should be pursuing. So I'm here to tell you a little bit about what that is and why it's helpful. So if you are to see a professional who offers exposure and response prevention, the first thing they're going to do is a very, very thorough assessment of what exactly it is that you're fearful of. What are the things that you've been avoiding due to this fear? And what are the things that you've also been doing when you're not able to avoid? And what your therapist will do with all of this information is build what's called an exposure and response prevention hierarchy together with you. So this is a collaborative effort between you and your therapist. And let's use spider phobia as an example, or arachnophobia. It's a much more exciting name. And what you and your therapists might build in terms of a hierarchy would be starting with the things about spiders that cause you the least amount of anxiety. So that could be something like talking about a spider or looking at a cartoon spider, all the way up to the things about spiders that cause you the most anxiety. So at the very top of your hierarchy might be something like actually touching, holding, interacting with a live spider. And what you do through the process of exposure and response prevention together with your therapist is you work up through your hierarchy to gradually expose yourself to the things that you're fearful of, while also preventing the response, right? So response prevention is the second part of this treatment. And here's what I mean by that. So it's likely that during the course of the development of your OCD or your specific phobia, that there were times when you absolutely couldn't avoid the thing that you were trying to avoid. So again, to use spiders as an example, let's say you were going on a hike and you absolutely knew that there was no way you were going to be able to avoid spiders. Maybe you start engaging in what's called different safety behaviors that you think will keep yourself safe, such as, maybe dressing yourself from head to toe in mosquito netting, or every few seconds, kind of looking around and making sure that there are no spiders. As you're going up your hierarchy, in addition to slowly exposing yourself to more and more fearful situations, your therapist will also be working with you to decrease that safety behavior so that you get the full benefit of the exposure. And there are reasons why this is important. So, what's happened over time is that the more you avoid something or the more you engage in a safety behavior when you can't avoid, you become convinced that those are the reasons that you're safe. That I'm only safe because I avoided spiders or because when I had to deal with them, I was covered from head to toe in netting. So that's why I was safe. So, in order to really get the most bang for your buck out of the exposure, the safety behaviors also have to go by the wayside. And what happens with repeated exposures over time is one, you learn that your fear response is really not likely to occur. Two, you learn that your feeling of anxiety will not go on forever. It may get very high. It likely will feel incredibly uncomfortable, but it will not go on forever, regardless of what you do, regardless of not engaging in a safety behavior. It will eventually dissipate and go away. And then you'll be able to move up further on your hierarchy until you're able to do things that, a couple of months ago, you wouldn't have even imagined yourself being able to do. And people sometimes ask, what's the purpose of doing this? Why would you ask someone to do something that sounds like it's going to feel so awful and uncomfortable? And the simple reason is because it is currently the most effective treatment we have for things like obsessive compulsive disorder and specific phobia. So that is a little bit about exposure and response prevention. I welcome any questions that you might have, post them below, and I'll do my best to answer. Thanks for watching.